Welcome to our guide on irritable bowel syndrome, IBS, and everything you need to know about managing this common condition. IBS is a chronic digestive disorder that affects millions of people worldwide. In this video, we'll cover the essentials of IBS, including how it's diagnosed, the risk factors involved, and the impact of stress and depression on the condition. Stick around as we dive into these important topics and provide you with valuable information to better understand and manage IBS. Irritable bowel syndrome, IBS, is a condition that affects your digestive system and is characterized by a set of symptoms that cause discomfort in your intestines. It's a widespread, but often bothersome gastrointestinal disorder. People with IBS frequently experience symptoms such as abdominal pain and cramps. They might also deal with diarrhea, constipation, or a combination of both. There are different types of IBS, classified based on the nature of bowel movements during symptom flare-ups. Most people with IBS will have normal bowel movements on some days and abnormal ones on others. The type of IBS is determined by the nature of the abnormal bowel movements. IBS with constipation, IBS-C. This type involves having mostly hard and lumpy stools. IBS with diarrhea, IBS-D. This type is characterized by mostly loose and watery stools. IBS with mixed bowel habits, IBS-M. This type includes having both hard and lumpy stools as well as loose and watery ones. Understanding these differences is important because specific treatments work better for certain types of IBS. The symptoms of irritable bowel syndrome, IBS, can appear regularly or just during flare-ups. This means that you might not always have symptoms. They can come and go, with periods of normal bowel movements in between. Common signs and symptoms of IBS include abdominal pain or cramps. This pain is often linked to the urge to have a bowel movement. Excess gas and bloating. You might feel unusually gassy or bloated. Diarrhea or constipation. Symptoms can include frequent diarrhea, constipation, or alternating between the two. Mucus in stools. You might notice a whitish mucus in your poop. Feeling incomplete after pooping. It may feel like you haven't fully emptied your bowels even after going to the bathroom. The exact cause of IBS isn't fully understood, but it's considered a neurogastrointestinal disorder, meaning it involves issues with how the gut and brain communicate. Problems with this gut-brain interaction can lead to dysmotility. This involves issues with how the muscles in your GI tract move food through your digestive system. People with IBS often experience more frequent muscle contractions in the colon, leading to cramps and pain. Visceral hypersensitivity. People with IBS might have nerves in their digestive tract that are more sensitive than normal, resulting in a lower tolerance to pain and increased sensitivity to discomfort. Other potential causes include gut bacteria. Studies suggest that people with IBS might have different types and amounts of bacteria in their gut compared to those without IBS, which could contribute to symptoms. Severe infections. Some people develop IBS after a severe gastrointestinal infection, hinting that germs might play a role. Food intolerance. Sensitivities or allergies to certain foods can trigger IBS symptoms. Childhood stress. IBS is more common in individuals who experienced significant stressors during childhood, including abuse. Certain factors can trigger or worsen IBS symptoms, though they don't cause the condition itself. Common triggers include menstrual periods. People assigned female at birth, AFAB, often find that their symptoms worsen in relation to their menstrual cycle. Certain foods. Food triggers vary among individuals, but common ones include dairy, gluten-containing foods, like wheat, and gassy foods or drinks. Stress. IBS is sometimes referred to as a nervous stomach because stress can trigger or exacerbate symptoms. IBS commonly affects people in their late teens to early 40s, with those assigned female at birth being up to twice as likely to be diagnosed. Other risk factors include food intolerance. history of severe digestive infections, past abuse, mental health conditions, anxiety, depression, or post-traumatic stress disorder, PTSD, are associated with a higher risk of IBS. Many people with IBS also have other chronic pain conditions, such as fibromyalgia, chronic fatigue syndrome, chronic pelvic pain. The first step in diagnosing irritable bowel syndrome, IBS, involves taking a detailed medical history. Your healthcare provider will ask you about your symptoms to get a better understanding of your condition. They may ask questions like, do you experience pain associated with bowel movements? Have you noticed any changes in how often you have bowel movements? Has the appearance of your stool changed? How often do you have symptoms? When did your symptoms start? What medications are you currently taking? Have you recently been ill or gone through a stressful event? Lab tests help rule out other possible causes of your symptoms, such as infections, food intolerances, or other digestive issues like inflammatory bowel disease, IBD. Not everyone needs the same tests, but they may include blood test, to check for signs of digestive diseases or other conditions that might be causing your symptoms, stool test, to look for infections or inflammation in your bowel, hydrogen breath test, to detect an overgrowth of bacteria in your gut, known as SIBO, or to identify food intolerances. Imaging procedures may be used to rule out other conditions that could be causing inflammation or abnormal growths in your gastrointestinal (GI) tract. These tests include colonoscopy, a procedure where a scope is inserted to view the entire colon. It helps identify conditions like polyps, IBD, or cancerous growths. Flexible sigmoidoscopy, similar to a colonoscopy, but focuses on examining the lining of the rectum and the lower part of the colon. Upper endoscopy. This procedure uses a scope to examine the esophagus, stomach, and the first part of the small intestine, duodenum, to diagnose conditions like celiac disease or other GI disorders. Treatment for IBS. There isn't a one-size-fits-all treatment for irritable bowel syndrome, IBS, but most people can find a combination of strategies that work for them. Treatments often involve changes to diet and lifestyle, as well as medications and therapy. It's important to note that these treatments might not eliminate symptoms entirely, but can help manage them over time. Dietary changes. A dietitian can help you adjust your diet to reduce symptoms. Here's what they might suggest. Increase fiber. Foods high in fiber, such as fruits, vegetables, grains, prunes, and nuts, can help with constipation. Introduce fiber gradually to avoid overwhelming your digestive system. Fiber supplements. Products like Metamucil R or Citracel R can be added to your diet if needed. Limit dairy. Many people with IBS are lactose intolerant. Cutting back on dairy products like cheese and milk can help, but make sure to get calcium from other sources like broccoli, spinach, or salmon. Reduce gas-producing foods. Foods like beans, Brussels sprouts, and cabbage, as well as carbonated drinks and chewing gum, can increase gas. Cutting back on these can help. Avoid gluten. Some people with IBS are sensitive to gluten, even without having celiac disease. If you try a gluten-free diet, work with your provider to ensure you're still getting essential nutrients. Adjusting your daily routines can also make a difference. Exercise regularly. Aim for 150 minutes of moderate exercise each week, which is about 30 minutes a day, 5 days a week. Moderate exercise raises your heart rate and can improve gut function. Try relaxation techniques. Techniques like yoga, meditation, and other stress relief practices can help manage the stress that might aggravate IBS. Sometimes, seeing a behavioral therapist can be beneficial. Get enough sleep. Strive for 7 to 9 hours of quality sleep each night. A consistent sleep schedule can help reduce stress. If sleep issues persist, consult with a provider. Many people find relief through various forms of therapy, which can help manage stress and related conditions, such as anxiety and depression. Cognitive behavioral therapy, CBT, helps change negative thought patterns and behaviors. Hypnotherapy uses guided relaxation to help manage IBS symptoms. Biofeedback teaches control over physiological functions to reduce symptoms. Your healthcare provider may prescribe medications to help relieve symptoms. Antidepressants. If you have depression or anxiety along with significant abdominal pain, medications like tricyclic antidepressants, TCAs, or selective serotonin reuptake inhibitors, SSRIs, might be prescribed. Constipation medications. Fiber supplements and laxatives can help ease constipation. Anti-diarrheals. Medications that firm up stools can help if diarrhea is a problem. Medications for intestinal spasms, to relieve cramping and spasms. Medications specifically for IBS include dicyclomine, Bentyl R, reduces muscle spasms in the gut. Hyoscyamine, Levsin R, helps relax the muscles in the gastrointestinal tract. Lubiprostone, Amitiza ER, increases fluid secretion in the intestines to help with constipation. Linaclotide, Linces ER, increases fluid in the intestines and helps with bowel movements. Finding the right treatment for IBS often involves trial and error, and it's important to work closely with your healthcare provider to tailor a plan that suits your needs. In conclusion, managing irritable bowel syndrome, IBS, involves a combination of dietary adjustments, lifestyle changes, and sometimes medications. While there's no universal cure, most people can effectively manage their symptoms with a tailored approach. By working closely with healthcare providers and experimenting with various strategies, individuals can find a treatment plan that helps alleviate their symptoms and improves their quality of life. Remember, finding what works best for you may take time, but with patience and persistence, relief is achievable. Please click on the next video for more Live Good info. Thank you very much.